Hello, everyone. You must be hearing a lot about vitamin D. Every other person that you know of must be deficient in vitamin D. And we get a lot of patients with a lot of doubts about vitamin D. So, in this video, I'll just try to clear some of your doubts and help you. So, what actually is vitamin D? Vitamin D is a vital amine. Vital means it is important for your body, and either you have to take it through diet or as a supplement. It acts as a chemical messenger. The first place where it acts is in your gut, and in the gut, it helps in absorption of calcium. The second place it acts is on the bones and muscle, and vitamin D helps in deposition of these calcium in your bones. So, what are these sources of vitamin D? Is there any dietary source of vitamin D? There are certain fatty fishes which are a good source of vitamin D, like salmon, bravas, mackerel, like bangra. So, if you are someone who likes fish, this can be a good source for vitamin D. Egg yolk is another good source of vitamin D. Now, all these sources they are high fat, so they can increase your cholesterol as well. But the best source of vitamin D is your own body. Our body can produce vitamin D when we are exposed to sunlight. But is vitamin D production in our body enough? Are we getting enough sunlight? That is something that we'll understand. Why we are always talking about vitamin D? We never heard our parents or grandparents take vitamin D supplements. So what has changed? One is life has moved indoors. We spend more time indoors. We hardly get sun exposure. So obviously vitamin D is not produced to adequate extent. Second is when we are exposed to sunlight, most of the times we use sunscreens, which block the rays which are responsible for vitamin D synthesis. When we talk about Indians, most of us are dark skinned, and melanin blocks a lot of this UV rays, and that's why again we are not able to synthesize adequate vitamin D. And lastly, possibly because we are now checking ourselves more, we are doing more regular blood checkups, which were not done in earlier generation, and that's why we now understand that most of us are vitamin deficient. Are blood tests compulsory before I start taking vitamin D? This is another common question. I don't think it is necessary because most of us are almost always deficient. To an extent, few studies say that 80% of Indians are deficient in vitamin D. So, if you want to take vitamin D, you don't necessarily need to test. It is safe to take vitamin D without any blood test. And whenever you do any of your regular checkup, annual blood checkup, you can just include vitamin D test and see whether you are sufficient in vitamin D. What are the normal levels of vitamin D? Different lab will have different reference range, but usually between 30 to 50 nanogram per ml is considered a sufficient vitamin D level. Levels between 20 to 29 are called insufficient, and when it is below 20, it is classified as deficient. When it is less than 10, it is called severely deficient. One very important thing to understand is vitamin D can also cause toxicity. And when the levels are very high, more than 100 nanogram per ml, it can lead to potential toxicity also. So if you are someone who is deficient in vitamin D, will you have any symptom? Very unlikely. Most of the times it's silent. You won't have any symptoms because of deficiency. When it is there for a long time, some people will have non-specific bone pain. You can have lower back aches. You can have muscle weakness, mainly around the hips and lower back. But the main concern happens when the vitamin D is deficient over a very long period of time, when it leads to reduced bone density, and it can lead to fractures. And that is when you understand that your bones are weak. How much and how long should I take vitamin D? So as I said, most of us are deficient, so we can safely take vitamin D. What we usually recommend is you start once in a week. You can take it for 8 to 12 weeks. After that, as a maintenance dose, you can take it once in a month. Maintenance dose is very important because when you stop your vitamin D supplements, the level starts falling again. Do you need injectable vitamin D, or oral form of vitamin D is sufficient? Mostly injections are not needed. Oral supplements are good enough. It is said that when the levels are very low, when it is less than 10 nanogram per ml, that is when injections can be given. But to me, the best indication of giving vitamin D injection would be someone who is taking vitamin D supplements very regularly, and in spite of that, their blood levels are not increasing. So that means that the vitamin D is not getting absorbed in your gut, possibly because of some malabsorption. And in that cases, injections are compulsory. Otherwise, oral form of vitamin Ds are sufficient. The last question is, do you need to take calcium supplements along with vitamin D, or vitamin D is good enough? Mostly calcium is not required. provided that your diet is rich in calcium sources, milk products, or any other source of calcium. And there are many factors which affect this. So we'll be making a detailed video regarding calcium in coming weeks. So stay tuned. Thank you.